Hello Gladiators fans, I'd like to welcome you to this edition of Gladiators TV. We're joined by Gladiators team dentist Dr. Bill Williams, and here at his offices on Suwanne Dam Road in Suwanne. And Dr. Bill, a sponsor of the Gladiators and the team dentist for 8 years. Talk about how you got involved with this with the Gladiators.
Well, Dustin, you know I was the season ticket holder for the Atlanta Flames back in the 70s, and I used to go down there and I got hooked on hockey because, you know, it didn't exist here in Atlanta up until that time. And I'd never been to a hockey game until they came to Atlanta. So time passed, the Flames left, and Thrashers came. I said, well, maybe I should get involved. But there was already a team dentist for the Atlanta Thrashers. Well, one of my friends who was that dentist said, well, there's another team coming here. The Gwinnett Gladiators are starting up, and this was about 2002 I heard this. And so I interviewed with Steve Chapman, the general manager, and we got along well. And out of 10 dental offices, he picked us to be the team dentist, and we've been there ever since.
What do you think helped you guys stand out? What kind of services that you guys offer do you think put you above everybody else?
Well, part of it, I think, was the comprehensive ability to treat everything the patient needs, you know, from the root canals to the crowns to the emergency medicine. I also was a member of the American Academy of Sports Dentistry, and I have some special training in making a particular type of a mouth guard that the hockey players indeed need.
Talk about that mouth guard and how important mouth guards are in the sport of hockey.
If you don't have a mouth guard, you're guaranteed to have an injury at some point. And what we found out was the custom mouth guard that we make is extremely good at eliminating the dental injury. And one good record we have is up until last year, we had no injuries of any player for 7 years who had been wearing one of our mouth guards. Now, one guy got hit with a puck straight in the mouth, and it busted some teeth. If he had not had the mouth guard in, he would have lost 5 or 6 teeth completely. As it was, he only cracked a couple of them. So it's been a big help.
So now, if you were interested in yourself picking up one of these mouth guards, how would you go about doing that? If you had somebody that was playing sports and wanted to make sure they had the professionally fit kind?
Well, we encourage every high school student who plays any sport like football or hockey, even basketball, to have some sort of a mouth guard. And you just get a dental impression, and then our laboratory here at the office takes care of it, makes it in the same 1 or 2 days, and they come back and pick it up and we fit it.
Now, besides just being able to offer these sports mouth guards, talk about some of the other comprehensive dental work that you guys can do here at Suwanne Dental Care.
Well, we like to say that we're the comprehensive dentist. There's about 10 different areas of dentistry that we work in. So you might could say we're the decathlon dentist.
Wow.
We do implants, extractions of wisdom teeth, root canals, partial dentures, cosmetic dentistry, which is making the teeth look good, bleaching, whitening. But we do gum work too. A lot of the oral systemic connection where the mouth and the heart and the diabetes and all these things that are related to inflammation, we can have an effect there too. So we're actually physicians of the whole body when you look at the ability to eliminate infections in the mouth that would travel other places.
Tell folks how to, more information if they're interested in getting some services done.
Well, if you're looking for our new dentist, then just try our website out, SuwanneDental.com. And you can look at us on Facebook, you can look at us on Twitter, you can follow us along. Suwanne Dental is our Twitter, and Suwanne Dental Care is our Facebook.
Now, you talk about being able to bring on new patients. One of the things I know that you've done over the past couple of years is getting a whole bunch of new patients that aren't really patients at all as you take a trip out to Kenya. Talk about how that came about.
Yeah, my brother's a pastor and has been in the North Georgia Conference of the Methodist Church for many years. And he was always going on on evangelism missions showing the Jesus film. And so it was never a medical mission, so I didn't feel like I could really participate. Didn't know much about showing the film. I wasn't into that. So he said, come over, we're going to build a hospital. And I said, well, I can do that. And so our family built a hospital in Kenya, and we went. And I've been going every year since we started, which was in the year 2000. So for the last decade, we've been going every year back to Kenya.
What time of the year do you guys usually make that trip over to Kenya? It seems like you make that every year and you come back with some great pictures and some great stories.
Yes, right before the season starts that we go. So we're here in Atlanta. We leave about May, June, July, one of those early months in the summer. And by the time I get back, I got all the films ready for you to see, so you get to see the newest films every year.
Talk about the experience of going over there and what's that like, being able to help those folks that definitely need the dental work.
Well, the thing about it is, well, where we go, there were no roads, there's no water, there's no infrastructure, there's no electricity. So we have to take everything with us. And we have a box that has a dental unit, we have a portable generator with gasoline, and we just crank them up, pull that lawnmower coil, you know, and the motor runs the drill, and I'll be injecting and pulling teeth 90% of the time, and I'll do about 10% fillings. There's no dentistry out over there available, and so when we show up, it's once a year. If we go to the same village. If we go to the different villages, maybe I'll go back every 2 or 3 years to the other villages. So they wait till I come back before they get anything done.
Talk about what's most rewarding about that experience. It seems like one that allows you to really see and make a difference.
Well, it is a joy to go back and treat people who truly appreciate what you're doing. I mean, they're the happiest people I've ever met. You think they're poor and you think they're going to be sad, but actually those are happy people because they're receiving some help that they wouldn't ordinarily get. And they just put forth a real warm welcome. You know, hospitality in Kenya is just at another level compared to anywhere you've been. Now, the best thing about it is once you finish, if you're a newcomer, you get to see the animals. You get to go to the Masai Mara Game Reserve or maybe the Nakuru Game Reserve. We'll take the people with us to a nice 2-day retreat at the end of the mission, and they'll get to see these animals that are famous in Kenya. The lions, the leopards, the cheetah, the elephants.
So a little bit of a vacation there at the end after being able to help everybody out.
Yeah, everybody deserves going that far to have a couple of days of seeing the natural wonders of Kenya.
Wow, that's an amazing adventure and something that you've been afforded obviously through the great work you do here in this community.
Well, I couldn't go without the support of all my patients. You know, if I didn't have a lot of patients here to support us, we would never have enough to go because it costs about $4,000 a person to take this trip every year. And so we have 20 to 30 people go with us every year. And I might make a note that people are welcome to come on the trip with us. We have a lot of people who are not medical trained. We have physicians, pharmacists, nurses, doctors of all types. But we also have teachers, school children of teenager age, college age students also. We have a lot of interns, residents from dental colleges and medical colleges go with us.
Now, do you guys also take donations as well if folks who can't go out there need a little bit extra help to be able to help you guys out there?
Yeah, obviously if somebody wants to help Kenya Medical Outreach, there's a donation technique on the website. You can go to kenyamo.com and there's a place you can donate right on the website. A lot of our people can't really afford to go, and they solicit their friends and relatives to help them pay for the trip. There's one lady who's been like 6 times with us, 6 years in a row, and she cleans houses to make money because she doesn't have a job at home. She's a housewife. So she cleans houses so that she can go to Kenya and become a servant.
Wow.
Now, when the people in Kenya heard that, they think, of course, that all Americans are quite rich. And so when they heard that she cleaned houses to earn the money to come to Kenya, it gave them a sense that this person really does want to serve.
Well, Dr. Bill, I'd like to thank you for joining us here on Gladiators TV. As had an opportunity to sit down and learn a little bit more about Suwanne Dental Care and some of the opportunities folks have here with Suwanne Dental Care, and just a little bit about the involvement with the Gladiators hockey team. I'd like to thank you very much for your support of the team this year.
Thank you, Dustin.
Looking forward to it for many seasons to come. I'm Dustin Bixby here on Gladiators TV.